Now let's talk about a very important one, that is leprosy. Okay. So leprosy as such is being done by which particular bacteria, guys? Mycobacterium leprae. And in Hindi, we call it Kusht Rog. And it is one of the, a very old disease being discovered up. And its name is there in our Vedas also. Charak Samhita. So Vedic times, this was being discovered up. Okay. Important here is that this particular Mycobacterium leprae is such a bacteria which does not follow Koch postulates. Okay, it does not follow what? It does not follow Koch postulates. And what are the Koch postulates? The Koch postulates is that every bacteria which cause the disease should be able to grow up in a pure culture media. But this particular one does not grow in any culture media. So this you need to know regarding the Mycobacterium leprae. So it does not follow Koch postulates. So this is one of the important questions. And along with that, which other traditional one is there which does not follow Koch postulates? That is Treponema pallidum. Is it fine? So this particular aspect or this particular point definitely can be asked in your Viva also, in the practical Viva. You should have an idea regarding that. Okay. So let's talk about the classification of the leprosy, and the classification of leprosy revolves around Ridley-Joplin classification. This is what is the widespread classification being used, that is Ridley-Joplin classification. According to that, the leprosy is being classified into TT, that is tuberculoid, BT, borderline tuberculoid, then we have borderline lepromatous, and finally what we have, lepromatous leprosy. And this is termed as Ridley-Joplin classification. It is termed as what? It is termed as Ridley-Joplin classification. Okay. So this you need to know regarding the classification stuff of this particular Mycobacterium leprae disease, that is the leprosy.